Следующая лекция Сарухан Cekirge «Ремоделирование потока как концепция лечения аневризмы нового поколения. Простота, высшая степень изощренности».
In the next half an hour, I'm going to be talking about the art of simplicity. So we call it flow remodeling as a next generation aneurysm treatment concept. And as you all know, one of the most important revolutionary change in aneurysm treatment created by flow diverters has been making the treatment possible for aneurysms, especially located in bifurcation, with an integrated vessel coming off the suck, which used to be the major limitation of endovascular treatment. So we described here a new aneurysm occlusion process called flow remodeling. And in follow-up studies, when we started to use this flow diverters back in 2007, we really start to shock and understand the effect of flow demand, actually creating a structural anatomical changes like in this basilar fenestration aneurysm, and one of the fenestration arm can be taken and placed on the pipeline, and 2 years after you see and there is a new basilar artery, and basically this was an anatomical change, structural change has been created by the flow demand of the vessel. So or in such an anterior choroidal aneurysm with the anterior choroidal artery is coming, and look at the origin of the anterior choroidal artery was here. However, you know, in the 2.5 years later, it is here. So what is this? Basically, the origin of anterior choroidal artery is changed accordingly with the reverse remodeling of the aneurysm. So these structural changes has been happening not only with the flow remodeling, but also with the parent vessels remodeling, with the power of geometrical modification, the wall pulsatility change and mesh density. But the geometrical modification and its related wall pulsatility change is one of the most important factors to be able to have such a remodeling in such a diseased artery 1 year after. So the importance is that what we use as a flow diverter is also very important. When we place a flow diverter at the neck of the aneurysm in such an aneurysm, like a pica is coming off the aneurysm, and anterior choroidal is coming off the aneurysm, and another one anterior choroidal is coming off the aneurysm. According to the flow demand of that vessel, aneurysm sac shows a reverse remodeling, and usually completed with excellent reconstruction with integrated vessel patency. However, treatment results somehow can be different. Like in such cases, and if there is a large temporal branch coming off that aneurysm sac, you place a flow diverter across the neck of the aneurysm, and 2 years later, some part of the aneurysm may stay there because the flow demand of that particular vessel is needed this part of the aneurysm, which is not to be called as an aneurysm remnant. So this is also another look to the aneurysm occlusion, which is very important. If the flow demand of the particular vessel is strong or exists, is not strong or exists, and flow diverter simplifies the bifurcation, and remodeling process ends with progressive asymptomatic occlusion of that vessel coming off the aneurysm sac. Like in this superior cerebral artery, you know, the flow diverter is simply placed with one PCA, and basically 6 months later, both aneurysms are getting reverse remodeled, and when you look at the 1.5 years later, there is a progressive asymptomatic occlusion of these both vessels because they are filling retrogradely from the collaterals. So then we call it in a different occlusion. The what is art of simplicity? What the art of simplicity necessitates here? First of all, you have to simplify the treatment, and you have to geometrically modify the artery. In such a basilar bifurcation aneurysm, of course, we like to do complex things, and you know, you can make a loop. I used to love that. I used to do a lot, and basically, I mean, you can do anything else here by stamping and other things. How about the simplification? When you simplify, and basically you take the easier track and you place your flow diverter, and you don't need to go through the aneurysm, and you geometrically modify, and this is the 6 months CTA, Actually, when you look at the 1.5 year, you already see the occlusion. So when you look at the deep, so you see this is 3D of the 1.5 year control, and while the aneurysm is being closed with remodeling, the aneurysm sac become continuation of the left PCA and SCA with two separate channels, with both vessels become thinner and hypoplastic. We call it class 1B. I'm just going to explain this in classification. Basically, this is how it remodels. But sometimes there is a remnant here, but we should not call it a remnant. I will tell you later. And also the simplification can be extended, like as we described this indirect flow diversion, which is actually treating the aneurysm not only without touching the aneurysm sac, but also the behind artery. This is aneurysm originated from that trunk, as you see, this is a here, but we treated the aneurysm in this indirectly in the secondary trunk with a flow diverter, and this is a 1 year follow-up. And basically, this is the simplification. So, for example, this aneurysm was treated in 2007 with a silk stent. We were so proud of at that time that we were able to place the stent into that pica, and it was the good result. But with that knowledge and experience and concept in our mind, I would do definitely this today. Not try to go into that pica. With the flow remodeling experience, I will definitely place a diverter in the vertebral artery, drop the diastolic flow, and let the pica remodel with the aneurysm on it. So basically, the thing here is sometimes we fail. The reason is not the concept failing. How many flow diverters is needed in starting? We don't know. It's hard to predict. We just know it with experience. For example, this patient came to me from Finland, and she has like 3 sisters died of sparagmoid bleed. And she was suggested all kind of bypass surgeries, all complex things about this pica, dissected very complex dysplastic aneurysm. And I basically simplified the treatment. I just placed a flow diverter across it. And 6 months later, there is the aneurysm occlusion and asymptomatic occlusion of the pica and retrograde fling. Pica, as you see here, this was a class 1C occlusion. So this is a asymptomatic occlusion of the pica. And you see how easy is the treatment. So there is the intimal hyperplasia in that Vantage stent, which we don't use anymore. I don't like the Vantage. I like to use pipeline, good old pipeline shield. So we standardly doing. For example, if you asked me 10 years ago how I treat this, probably I was going to be describing coming from a bow and placing a stent and coming from ipsilateral to the coil that pica. I love that doing. It is nice. It is so complex. We like to do complex things. But today, with the knowledge, it's a dominant pica, couple of pipelines, and this is 1 year after. And again, class 1C occlusion with the aneurysm occlusion, and there is enough collateral and asymptomatic occlusion of the pica. So, this is an ICA aneurysm, ruptured ICA, and we rarely use flow diverter in ruptured aneurysms, but I tried everything to get in here. It was not possible, and basically we placed a flow diverter. And this is the 5 years follow-up with indirect flow diversion done from the basilar artery here. And you see that reverse remodeling and maybe some part of the aneurysm needed here to be able to keep the flow conduit. And this is just a nice stable remodeling. This is a case that I got from my good friend Ishtak, and this is the MCA aneurysm. I'm going to be diluted later on. And you see complex MCA, and there's a bifurcation aneurysms, and also there are some other aneurysms. Multi-segmental disease goes into the superior trunk. So while he was treating that, placing a stent to the
В
inferior trunk,
процессе
as you see,
лечения
the
был
other superior
введен
trunk aneurysms was also treated
стенд
with
в
indirect flow
нижний
diversion. And this
ствол,
is a
и
1-year
также
follow-up.
было
You
проведено
see that,
лечение
and
с
basically that, although it
непрямым
is still
ремоделированием
patent, but it's
потока. И вот
lesser in
посмотрите, какая
size. So this is
ситуация.
complete
Далее
occlusion
уменьшение
with the
размера,
integrated
полная
vessels
окклюзия
hypoplasia, which is
с
class 1C occlusion, class 1B occlusion.
интегрированной
This is a patient that I'm proud of to show. This is somebody I trained, and a
сосудов.
39-year-old female with severe headache,
Посмотрите на
and it's a
случай.
pretty complex
39-летняя
giant aneurysm. The
пациентка
patient had
страдала
a
от жестоких
ICA
головных
occluded
болей.
and
У
giant
пациентки
IC
была
aneurysm
окклюзия
fed by
правой
the PCAM. So basically,
нижней
this is
мозговой
right PCA
артерии.
goes
Вот
into the aneurysm
здесь,
with the PCAM,
посмотрите,
makes the ICA aneurysm, and
прямо задняя
continue with
мозговая
the
артерия, куда
right
заходит,
middle cerebral
продолжается
artery. So
дальше
basically, the almost
правая
all right hemisphere
средняя мозговая
dependent
артерия.
on that
И
PCAM
в
and that aneurysm,
зависимости от этого
aneurysm
участка
flow.
и далее от
So
аневризмы, от
when you look
потока
at the,
аневризмы,
that's what he looked at. He first tried to go with the loop
сначала
from the PCAM and
попытались
try to thinking about then placing a stent here and do the
работать по
coiling and try to
петле,
reconstruct here this flow conduit.
койлинг,
However, it was not going to be
реконструкция
possible because here
потока,
it's
и
impossible
выяснилось,
to place
что
the stent
просто
there. So then he
невозможно
realized that
введение
he
стента.
remembered
И тогда
what he learned
доктор
from me, just the art of
вспомнил,
simplicity.
что он
So
узнал
basically, he just placed
у
a couple of
меня
stents
об
pipeline
искусстве
across to
простоты,
PCAM
поэтому
just to
использовали
reduce
здесь
the flow of
стенты
the PCAM
пайплан
going
для
into the
того, чтобы
aneurysm.
снизить
And this is
поток.
the other sides, the filling the right MCA very weakly,
Вот
but
здесь, в
immediately
правой
after
средней
treatment was
мозговой
done,
артерии,
look at this.
ситуация
The
после
aneurysm starts to
лечения.
stagnate,
Посмотрите, начинается
and right
стагнация
hemisphere start to fill
аневризмы.
from that
И вот
ipsilateral,
здесь
the contralateral
идет
ICA.
наполнение,
And
контралатеральная
1 year later,
нижняя мозговая
beautiful
артерия.
treatment result,
И
complete aneurysm
результаты
occlusion.
через
So
год
here,
мы можем
not the technique,
посмотреть. Здесь,
simplicity and
что
concept
важно,
treats the patient. Okay, the
простота,
simplicity, art of simplicity treats the patient. Secondly, the flow remodeling effect
практически
of
вот
these
такой
treatments, the angiographic
простой
results
подход
substantially
оказался
differ from those
адекватным и
endovascular packing.
достаточным.
That's why you know this classification. We created this
Здесь
classification to be able
представлена
to talk the same language
классификация
with us
окклюзии,
and between us.
и
And
это важно,
basically,
чтобы мы все
when
говорили
there
на
is a
одном
integrated
языке.
vessels, full patency with the
Здесь
complete
мы
occlusion. We call
видим
it class
пациенты
1A in
с
such a bifurcation.
класс 1А,
When
вот такая
there is a
бифуркация.
hypoplasia of that
Есть
integrated
также
vessel. Here is the
гипоплегия с
pericallosal artery, which was
вовлеченным
integrated to the pericallosal aneurysm.
сосудом.
Basically, flow diverter was
Здесь
placed from the A2 to the
фактически
callosal marginal.
флоударветер
Then
был
the flow
введен.
demand kept the vessel hypoplastic. This is class 1B. And
Класс
sometimes this
1Б.
goes
И
occlusion. This is the,
иногда,
again, ruptured the distal
посмотрите,
anterior cerebral
здесь,
aneurysm
вот
with the
здесь
pericallosal
разрыв,
integrated here. And this is
здесь
the 6 months follow-up
вовлеченность.
with a
И
class 1C occlusion.
посмотрите на
An 18-month
ситуацию
follow-up.
через 6
It turned out to be
месяцев.
class 1B.
Класс
Sometimes
1С, а
it changed,
через
it showed
1,5
interval
года уже
changes
класс
between control
1Б.
DSAs.
И
The
иногда
flow remodeling.
происходят
6 months follow-up
изменения.
reveals occlusion of the vessel with retrograde filling. However,
Посредством
18-month follow-up
ремоделирования
showed
потока
the
вы видите
hypoplastic
разницу
pericallosal with
между
integrate
6
filling.
и 18
It develops, the
месяцами.
flow remodeling develops in a longer period of time, showing these changes. For example, in the
Ремоделирование
6 months
потока
follow-up,
формируется
you see the
на протяжении
aneurysm
более
is
длинного периода
completely
времени
reverse
и
remodeled,
показывает
and
некие
it turned out to
интервальные
be
изменения
continuation of the
на
vessel.
контрольной
If it
ангиографии.
shows a
Вы видите,
different
что здесь
course than
продолжение
before, we call
сосуда.
it class
Вы
5
видите, что
occlusion in the first
другое
control. And the
направление,
flow
чем было
diverter was
ранее,
obviously
класс
placed from
5.
M1 to the inferior trunk,
И
jailing the
здесь
aneurysm
вы
and the superior
видите
trunk. And
изменения
it changed in 1.5 year with
через
complete
1,5
occlusion
года мы
and that vessel's
видим
hypoplasia, which is class
продолжение
1B.
изменений, полная окклюзия,
However,
гипоплегия данного
in not all
сосуда.
every cases we have this
Но
beautiful
вот
complete
такая
reconstruction, complete aneurysm
красивая
occlusion for such embryonic
реконструкция
PCAMs.
не
There
во
are there are a lot of misinterpretation in the
не во
literature that
всех случаях,
these
конечно,
should not be treated with
наблюдается.
flow diverters. This is a failure. Or that,
Часто
this is not true.
бывают случаи,
Because
когда нам
these
говорят,
papers,
нет,
this literature
ремоделирование
is based
потока
on
здесь неверно,
almost
это
with
отражается в
many of them
литературе.
with a single flow
Но
diverter.
дело в том,
We know
что
that with a single flow
в этих
flow
случаях
diverter, it is
используется
impossible to
один
shut down or
гарвётер.
to
И
control the
мы
flow
знаем,
demand of this
что
embryonic pickup.
при
In
единичном
this
гарвётере
particular case,
невозможно
we
закрыть
placed
или
3
контролировать
the
поток.
pipeline flow
И
diverters, and this
здесь
is
мы
the 3 years
используем
follow-up, and this
несколько
is the 10 years
флоу-дайвертеров
follow-up.
пайплан.
The question
И
is
вы
it
видите
an aneurysm
изображение
remnant?
контроля через 3 и
Are we
через
doing a
10
plastic
месяцев.
surgery? Are we
И
cosmetic
здесь
surgeons? What is the
вопрос,
aim of the
кто мы,
aneurysm treatment?
пластический, косметический
Isn't
хирург, и
that to
какая
keep the
цель
patient from
вообще
a bleeding
лечения аневризмы?
or
Это
just chasing
предотвратить
after a
геморрагию
beautiful pictures?
или
So we
просто
have to
получить
think about
красивую
that.
картинку?
It's another peak
И
aneurysm showing
здесь
nice
мы должны
remodeling in the long
подумать,
term.
что же
And
нужно.
basically, in the
Еще
embryonic
одна
pickups, at least
долгосрочное
2 pipeline
успешное
or maybe 3 pipeline
ремоделирование,
needs to be placed to
по
be able to
крайней
have
мере,
this.
2 или 3
This certain paradigm
стента
shift created
пайплайн
by flow
необходимо
remodeling
использовать.
in cyber-aneurysms
Здесь
inspired us the
мы
treatment of those
видим,
complex
что
bifurcation aneurysms. We
произошла
start to look them
некоторая
in a different
смена
angles,
парадигмы
and we start
в
to treat them
рамках
with flow
концепции
diverters in
ремоделирования
2007.
потока. С
When I first
2007
showed these
года мы
cases in Valdezar, it got a lot of
используем
reaction, but with the
флоу-дайвертеры,
building
и
experience,
сначала
a
была
lot of our trainees
очень
starting doing
неоднозначная
this,
реакция,
and
но по
it
мере
gives an unbelievable
накопления
simplicity in
опыта
such a
мы
bad
подтвердили
looking aneurysm.
важность
And of course,
достаточной
I just see the lecture that,
возможность
I mean, since
простоты
12
применения
years, we haven't used
методики при таких
in a single
сложных
patient the
аневризмах.
clopidogrel.
И
Clopidogrel is a useless,
мы ни
completely
разу не
untrusted,
использовали клопидогрель за все
untrustable
эти
drug,
годы ни на
and
одном
in our
пациенте.
population is
Нет
actually more than
доверия к этому
35% resistance rate.
препарату.
I know
И
your Russian population is
мы
also pretty high. I
понимаем,
know from some Russian
что
patients, and they are pretty similar to our Turkish group. They have a pretty
достаточно
high resistance rate,
хорошая
and
реакция. И мы
I
знаем,
don't remember
что
any
ваш
stent I removed from
опыт,
the circulation in the
в
last
общем-то,
12 years
такой
after
же.
we started
И,
using
честно
Prostogra.
скажу, я не
So
помню удаления
basically,
ни
this is the
одного
patient, and 2 years after,
стента
and this is
после
done
того,
by
как мы
one of my
начали
former
применять
fellows,
эту
just finished her
технологию.
fellowship
Вот
and
один из
treated this
моих
patient, and this is
коллег,
8 years
это
follow-up.
его кейс.
So
И
look at
здесь
this
вы
aneurysm
видите
and look at this
контрольные
simplicity
снимки,
in the treatment
посмотрите на
result.
аневризму и
But we like to
посмотрите
do a
на
lot of complex things, like a
простоту
Y
решения.
stent,
Но, как
X
я уже
stent, T
сказал, нам
stent.
очень
We
нравится
describe
применять
that and we
сложные
publish that. We
стенты
describe that
YX,
intra-aneurysmal loop
где
technique. I published that, and
описание различных
we like to do Y
методологий, как
stenting,
лук
X
и так
stenting, and
далее.
this is
Это
again a
нам все
complex
очень
case that
нравится. Чем
Sachi did
сложнее, тем
like in
лучше. Вот
almost 8
такие были
hours doing loops
подходы,
and do
когда
Y
мы 8
stent and
часов
great results, but
выполняем
not in every
петлю,
cases.
используем
And can we
white
do
stand.
this in every
Замечательные
cases like
результаты.
in
Но
this?
вопрос,
Is it possible? So
всегда
if
ли
we
так
place a
можно
flow diverter
в каждом
at the neck of
случае,
such an
если
aneurysm,
мы
the treatment result was reproducible. This is a
помещаем
very
флоу
historical
дайвертер в
case that
шейку
actually
такой
we first
аневризмы? Это
described that, and
воспроизводимо,
this was
это
one of the probably the
исторический
first case was shown in Valdezar, and it got
кейс.
a lot of
Это
reaction at the
первый
time.
кейс, который
And
был
but
показан.
this is the
Очень
18-month
большая
follow-up,
дискуссия была по
and
этому
the answer
поводу.
to
И
question,
вот
yes, this has been definitely
при
reproducible.
последующем
And we first
наблюдении
published
решение
that,
было,
then
что,
we expanded
конечно,
our
это
series,
абсолютно
and now this is
воспроизводимо.
one of our
И вот
standard
такая
treatments
простота
in
подхода
bifurcations like that,
позволила нам
and even the
расширить
easier cases.
серию,
And this is a
и
trunk,
мы
the
используем
important
это в
vessel
разных
coming off the aneurysm
случаях.
sac.
Это
The flow diverter is
основные
placed, and look at the
сосуды,
follow-up result.
и
That the
вот
flow demand of that
размещение
vessel kept the
дайвертера,
vessel patency.
и
Even that stenotic area
вы
just healed up.
видите, что
So,
по-прежнему эффективно работают
how we do it?
сосуды.
First
Итак,
of all,
как
the
мы это
treatment concept
осуществляем
target needs to be
при
understood.
лечении аневризм
Simplify and
бифуркации?
geometrically
Ну, во-первых,
modify,
самое
and let
главное —
it flow
упрощение
remodel by the
подхода,
time.
геометрическая
So basically,
модификация
you
и
pick the easier trunk.
позволить
Here is the
ремоделирование
superior trunk.
потока с
Of
течением
course, the
времени.
simplicity.
Вот
This is a complex aneurysm,
видите, достаточно
bilobed, and another
сложная
lobule at the neck. And
аневризма,
this is the 6 months and 2 years after nice
состояние
remodeling.
шейки.
And
И вот
the
через 6
target
месяцев
philosophy is to
контроль
simplify.
показал
Again, what is
успешное
simplification? Of course, the
ремоделирование.
straight axis. Just place the flow diverter.
Здесь
Okay, so
Посмотрите,
this is the 1-year
вводим
follow-up, which is a class
флоу-дайвертер,
1A
а дальше
occlusion,
мы
2 years
смотрим
follow-up, and this is the
окклюзия,
3 years follow-up.
класс 1А,
Geometrical
ситуация через
modification of
3
the
года.
bifurcation with the
Геометрическая
flow diverter is the
модификация
key.
бифуркации.
So
Здесь
look at this
ключевой момент
multi-segmental
флоу-дайвертера.
disease of the
Посмотрите
MCA
на
bifurcation, and look at this angle is about
многосегментарное
90 degree
поражение,
between inferior
посмотрите на
trunk and M1.
угол
So you
90
place a pipeline,
градусов,
the angle is
вводим
already
пайплайн,
150,
угол
140
уже
degree,
150, что
and
40
at 7
градусов,
months
и
control,
при
I'm going to show you in a
контроле
bigger
через
picture.
7
This is 3 and
месяцев
7 months
увеличим
control.
картинку,
There's a
3 и 7
straightening of the whole vessel.
Посмотрите до
So
лечения и
basically, this is the
контроль
most
через 7
important factor.
месяцев
Not
ситуации.
every flow diverter
Поэтому очень
works in
важно,
that
что не
way.
каждый
It gotta be
флоу-дайвертер
concobalt. It gotta
работает
be stiff.
таким
You know,
образом.
we were, as
Должен
operators, we were asking from the
И как
industry this
операторы
easier stuff to
мы
push.
хотим,
We
чтобы
like to have
производители
to make it
предлагали нам
easy.
продукт,
But
который
again, we are
достаточно
treating a very
легко,
complex
удобно
aneurysms,
проталкивать.
and
Но
the
мы должны
push
понимать,
of the
что
chrome
аневризмы
cobalt is
очень
always harder than the
сложные. И
nitinol, but
поэтому,
the
конечно,
results are going
всегда
to be
это будет
different. So
сложнее, чем
basically,
нитинол.
we should
И
not be chasing
поэтому
after always
мы
the
не
easier flow
должны
diverter to
всегда
push, because it
добиваться
means that
и
they are
думать, что
softer.
всегда будет
So they
достаточно
are not going to make this
просто.
angle
Но
change,
это
geometrical
значит также, что
modification,
несколько
and then you're
будет
not going to
несколько
get the
мягче,
same
и не всегда
results with the
удастся
other
обеспечить
small, soft
геометрическую модификацию.
microflow
Не
diverters.
всегда
I like
не
them.
будут
I like
получены
to
те же
use them
результаты,
in
как с другими
M3, M4.
более
They are
мягкими
great, but
микрофлоу-дайвертерами. И
this
мне нравится
geometrical
использовать
modification
М4,
effect
но эта
in this
геометрическая
bifurcation with this
модификация
simplicity and
при
basically
такой
is different with
бифуркации
the chrome
мы
cobalts.
видим,
And this is
что,
a
конечно, могут
complex
быть немножко
widening
разные
aneurysm
результаты.
again,
Вот да,
and this is
еще
very
одна
simple
сложная
treatment,
аневризма мы видим
simple
до
vessel,
и
and basically good.
постоперационно, и достаточно
So
простая технология применена.
there are a bunch of examples I'm showing you, and
Целый
again,
ряд примеров.
simplicity is chasing after,
И
and
опять-таки главное здесь
in some cases,
простота.
if there is
В
no
ряде
flow demand of
случаев,
that particular integrated
если
vessel, flow diverter creates an aneurysm occlusion with
нет
asymptomatic
потока в
occlusion of the critical
определенном
trunk.
сосуде,
This is the superior
то
trunk.
тогда мы
Simplicity offers here just to go the straight access,
введением
and 6 months
флоу-дайвертера
later, this is we
видим
call it class 2,
окклюзию
but 1 year
аневризмы
after,
симптоматичной
it is class
окклюзии
1C
основного
occlusion. So
ствола.
total
Здесь вы
aneurysm
видите
occlusion
класс
with
С
integrated vessels
окклюзии.
asymptomatic occlusion.
Видим разные
Again, this
стадии
patient came with the
процесса.
ischemic finding. It's one of my
У
fellows
пациента
patients.
было
Again, it's very
ишемическое
interesting. And post-op ESA,
поражение.
in such
И
large and
здесь
giant
мы
aneurysms,
видим
when we do the flow diversion,
постоперационное
not only we use
дигитальная
prosegrad, but also we
ангиография,
use
и также
anticoagulation to
постоперационно
be able
через
to
72
control
часа
the clotting
использовались
in the aneurysm.
антикоагулянты
So
для того,
in this
чтобы
patient, superior trunk is
контролировать
integrated to the body.
тромбообразование.
Obviously, the easier out
Здесь
of
мы видим
simplicity necessitates to
вовлеченность
go to the
ствола
inferior
в
trunk.
тело
And this is post-op
аневризмы, и
MR and
в
diffusion
данном
MR. And this is the
видим
third month
МРТ,
follow-up. Aneurysm occlusion
также
with
контрольная
the
через 3
integrated superior trunks
месяца,
occlusion,
и
which is filling
видим
retrograde. And this is the
окклюзию,
third month, the
видим
MR imaging of
ретиноградность.
this particular patient. The target of simplicity is the same for
Какова
ACAVs.
цель
You know,
простоты
same
подхода?
thing. This is the ACAV aneurysm with the right A2
Прежде
coming off the aneurysm
всего,
sac,
мы
and
видим,
easiness is left
примерно,
A1, left A2
и
flow
мы
diverter and jailing
видим,
the
что
aneurysm
здесь
and the
достаточно
integrated
просто
right A2.
используем
This is 6
флоу-дайвертеры,
months later, aneurysm is
интеграция,
occluded.
вот
What happens to
окклюзия
the right
аневризмы
A2?
через 6
It starts to fill
месяцев.
more from the right
Мы
side.
видим, что с
It
правой
was
стороны
hypoplastic with the
больше наполнения,
remodeling of the flow. Right
гиперпластика
A1
с
got bigger.
ремоделированием потока.
So if both trunks are
И
relatively easy,
если
which means that
оба
this case
ствола
can be treated with other
относительно
means. That's another question.
просто
But we believe in this treatment. We
реализуются,
still, and
мы
especially with the
считаем, что
medication,
при этом
and
лечение,
even in
особенно
some
при
many
использовании
cases that I
медикаментозной
can treat with stent-assisted coiling or Y-stent
терапии,
assisted coiling, like
и
in this
когда
case,
я также могу
we still
использовать
do a
стенд
flow diverter and
ассистированный
basically
койлинг и так далее,
go
мы
to the
по-прежнему используем
trunk, which is
флоу-дайвертер,
larger
заводим
and
в
which you think that you're going to
ствол
create
более
the most
крупный,
ultimate
и
geometrical
мы
modification. Okay, so here is the
реализуем
inferior trunk.
максимальную
So
геометрическую
basically, you
модификацию.
go
Это
there
нижний
and you change the
ствол,
geometry,
и Вы
and we
видите
basically oversize
изменения
according to the proximal vessel
геометрии
about 0.25 to 0.50 for the
от
convexity to
0,25
give
до
at the time to the aneurysm
0,5
occlusion. And this is the
изменению,
1-year follow-up. You see the
увеличение,
angle is
и мы
almost
видим контроль
170
через
degrees
год практически
at 1 year.
170. Теперь уже угол.
So, if both trunks are difficult
Если
and
оба
dependent, choose the
ствола
larger one
достаточно
and let the
сложная
smaller one
геометрия,
remodel.
они взаимозависимости, то тогда
Choose the larger one, let the
избираем
smaller one
более
remodel. This is a
крупный
complex fusiform ACOM, and right A1 was not here, and then
сосуд
geographically,
и
so the
осуществляем
larger one was
ремоделирование
wired and
меньшего.
placed, and basically
Тем,
1
что
year after the aneurysm is occluded,
смотрим
and
на
look
контроль
at the
через
right
год,
A1 was very
окклюзия,
hypoplastic, and
аневризмы,
now it is
и
more visible here
видим,
because of
что
the flow
сейчас
redistribution
визуальность
and flow
увеличивается
remodeling.
благодаря
This was an aneurysm we treated as one of the
перераспределению
former WL
потока
NCs, I believe, in
с помощью
2000,
ремоделирования
2001,
в
2021,
2000.
and both trunks are hard.
Вот
So
посмотрите,
using a loop
здесь
technique, we're going to put
достаточно
flow diverter in one of
сложные
them
оба
because there's a
ствола, и,
multi-segmental disease
используя
too. So this is basically the
соответствующие
larger one, and also
методологию, мы
which we
видим,
think that
что
we're
это
going to create the most
многосегментарное
important
положение, и
geometrical modification.
здесь
So
очень
here is
важная
almost 70
геометрическая
degree angle.
модификация
Now that
осуществляется.
70
Угол
degree angle turned out to be
был
140,
практически
150 degree.
70,
And
а
this is the
теперь
6 months follow-up.
140-150
And this is the, again,
градусов.
6 months
И
follow-up
контроль
before
через
and
6
after
месяцев. Вот здесь
the
опять
before
контроль через
operation 3D and the 6
6
months
месяцев
3D,
по
showing
сравнению
nice
с
remodeling, reverse remodeling
предоперационной
of the
картиной
aneurysm side.
достаточно успешно
And good flow
проведено
diverter startup
ремоделирование
position is very
потока.
important.
Очень важно
Again, for
начальное
ACOMs, it's the
положение
same thing.
для
It's the subcallosal
хорошей
artery coming off the aneurysm
реализации
sac. It is the
положения
nightmare of
стыда.
the surgery and endovascular
И
treatment. If you don't recognize and coil
при
this sac
хирургии,
or
при
clip this
эндоваскулярном
aneurysm, then you're
лечении,
going to have a
если
plant patient.
вы
And
распознали,
basically
вы не
here is
клипировали, то
beautifully
тогда будут
placing
большие
a flow
проблемы с
diverter from
пациентом
left
здесь.
A1 to left
Очень
A2. 1
хорошо
month
с
later, the
левого
aneurysm is gone and the
A1 на
subcallosal artery is patent.
A2
And here
заведен
is the 1-year
эндорвютер.
DSA
Здесь
showing a nice patency of the
дигитальная
subcallosal
ангиография
artery
через
with
год.
a new origin of the
И
artery. The aneurysm has a
здесь
new origin,
мы
which
видим,
means
что
that
у
aneurysm
аневризмы
showed
как бы
has such a
новый
remodeling that it becomes a
поток, новое
continuation of that
происхождение.
subcallosal artery. As I
Видно
mentioned, the
такое
modern
моделирование,
antiaggregation needs
что
to be adapted
считается
using the
продолжением.
second
Кроме
generation drugs,
также
Prostogra
необходимо
and Ticagrelor, because
использовать
this is very, very
современные
important.
антиагрегантные
And
методы с
so you don't have
применением
to remove the
препаратов
stents. And also,
второго
if you're going to
поколения.
use
И
if you
если
have to use clopidogrel,
необходимо
and then
использовать
please don't do this.
клопидогрель,
This is so clear. Okay, this is so
пожалуйста, не
clear. And
осуществляйте эту
again, this
технику, это
aneurysm can be
очень
treated with
ясно.
other means.
И
And however,
эта
if you're going
патология
to do
может
this, if you're going to have
лечиться
this, if you want to have
другими
this result,
средствами.
there is
И
no
если
way
вы
to reach these results
хотите
with that low
получить
morbid
такие
mortality rate using
результаты
clopidogrel.
при
At least
низком
in my
уровне
population here in
летальности,
Turkey,
не
this is
надо
not
использовать
possible.
клопидогрель, не надо
So in
лечить
regard of
такие
the
аневризмы
controversy in
использованием
publication,
клопидогреля.
after
По
our
крайней
first
мере, это мой
publication, there was positive
личный
publication, there were
опыт.
negative
Также
publications.
были
Actually, it
различные
was not because of the
публикации,
stance
была
mistakes, it was because
критика,
of the medication we
и
don't know. And
это был
that's why the Sharper and
скорее
I, we
не
realized
с
that, in
ошибок
two groups,
с
because
использованием
both groups,
стента, но
they
также
are
и с
monitoring
медикаментозной
their
терапией,
anti-aggregation very
и
properly. And when we realized that in our
мониторируется
complex
использование
63 complex
антиагрегантов.
aneurysms, MC
И
aneurysms,
здесь у нас было
we proved that this
63
can be done with
сложных
very low
аневризмы.
morbid
Мы
mortality
доказали,
and
что уровень
morbidity
смертности и
and with a very high rate of
заболеваемости
aneurysm
может
occlusion.
быть
And of
очень
course,
низкий, с
it depends on how
высокими
you look at the
показателями
aneurysm occlusion.
окклюзии аневризм.
So,
Опять-таки
total
вопрос, как вы
occlusion is,
подходите к
that's
аневризмам
98%
окклюзии,
at
полное
almost 60 months.
закрытие
But we call it class 1
98%,
A, 1B, 1C, and also class 5 stable remodeling as
и
a complete
классификация
occlusion.
1А,
This is
1Б,
very important.
1С, даже
So the post-treatment
5.
follow-up
Это очень
morphological
важно.
expectations of us is very important.
Наблюдение после
So,
лечения
this is
и
aneurysm with
соответствуя
a bleb.
ожиданиям нам также
This is a
очень
1-year
важно
follow-up after
аневризма,
placing a simple flow diverter in
кровотечение
here.
после
And this is the 5 years follow-up, and this
осуществления
is 7
простого
years.
ремоделирования потока.
So,
Вот
what is
результаты
this?
через 5-7
That's the
лет.
question. I
И
mean,
что это
are we doing a
такое?
cosmetic
Вот
surgery? Are
вопрос.
we going to retreat this?
Осуществляем
What is the
мы
aim of this treatment? None of these
косметическую
patients has
хирургию,
a
какова
rebleeding.
вообще
So
цель
basically, when we have this new
лечения. И сейчас
understanding,
у нас
this is all about
новое
treating the patient,
понимание,
protecting
что
from a bleeding,
главное
but
это
not treating
лечение
the picture.
пациента,
Again, a
защита
wide neck
пациента
MCA
от
bifurcation aneurysm and
кровотечений, а не
trifurcation.
просто,
It's
что
simplified with the
называется,
flow
лечение
diverter. This
картинки,
is 6
создание
months follow-up,
красивой
and this is
картинки.
18 months follow-up. This is class 5
Упрощение
stable flow
достигается с
remodeling.
помощью
Very complex
ремоделирования
trifurcation,
флоу
both
divertера.
trunks,
Вы
medius and
видите,
superior trunks
очень
coming off the aneurysm
просто
sac,
оба ствола
and
выходят из мешка
simplification,
аневризмы,
1 year and 3
упрощение
years.
подхода,
This
и
is
мы видим
class 5
контроль
stable
через год,
remodeling.
через 3,
I know
класс
we have great
5,
surgeons, you can clip
устойчивое
this, you can
ремоделирование.
reconstruct here.
Конечно,
I
замечательные
mean, it's
хирурги могут
impossible to do that
клипировать,
endovascular there. What you're
реконструировать.
gonna
Это
do here? It's
невозможно
almost
делать
impossible with the Y standing or whatever.
эндоваскулярно. И
And
что
or
что
in
тогда
some
будем
cases, it
делать?
is very
Или в
possible
ряде
to wire
случаев
that and
вполне
place a stand. Why?
возможно
This is the
расширить,
15-month
ввести
follow-up,
стенд.
and this is the
Почему
5-year CTA.
контроль через
If you do the 3D,
15
in some
месяцев,
cases,
через
you
5
realize that this is
лет?
actually not
И в
aneurysm
ряде
remnant. This is
случаев
just the
мы
reverse
понимаем,
remodeling
что
that
это
part of aneurysm become the
старое
continuation of that
ремоделирование
inferior trunk, which was
и
integrated.
продолжение
Again,
в нижнем стволе, который
the simplicity
вовлечен.
goes to superior trunk.
Здесь мы
Treatment was done.
видим
And here is the
простой
6 months follow-up.
подход, лечение
Typical
осуществлено,
neuroradiological
контроль
approach here
через
is,
6
oh, this is the aneurysm
методов.
remnant. Oh, it's a
И
trouble. It's a failure for treatment.
иногда может быть, что проходит
Okay,
время,
this
и
is
мы
the
говорим,
3D.
ой, это
It is still aneurysm
аневризма,
remnant.
это
Just do the treatment. Do the 3D
неудача.
at the
Через
6 months
период
follow-up.
времени
And
мы
this is the
смотрим,
3D angiography.
проводим
And now look
лечение,
carefully.
используем трехмерную ангиографию,
So
внимательно
this is the reverse
наблюдаем
remodeling of that vessel.
и
First of all, do
смотрим
3D. But sometimes you
ремоделирование
see a
сосуда.
clear residual-like appearance,
Иногда
but
мы
they
видим
stay
очень
stable because
четкую
that particular vessel
остаточность,
needed to
но
keep that
мы
flow
видим
continuous. So
устойчивость,
why we gonna
потому
call
что
it flow?
если эта часть
The aneurysm.
сосуда нужна,
This is the MC aneurysm we treated in
то,
2022
может быть,
WLNC with
это
discussion.
нормально.
A lot of
Вот
surgeons was
один
of
из
us,
случаев, который
recommending the
вызвал
surgery,
активную
the Y
дискуссию.
stenting,
Ряд
all
специалистов
kind of
рекомендовал
things. We
хирургическое
just simply place a
вмешательство и
flow diverter
множество других
to the superior
вещей.
trunk.
Но это простой
Okay?
случай для
This is the 1 month
флоу-дорвётера.
CTA. Sometimes you
Контроль
get a very fast
через
result. Sometimes you
месяц,
get slower results.
ангиография,
And this is the
и
8 months.
иногда результаты
Okay, since it's the first
достаточно
control, we call it
медленно
aneurysm
наступают, через
remnant.
8 месяцев.
And this is 2 years follow-up.
Смотрим на
So
контроль
this is class
потока, мы
5
называем
stable flow
остаточность
remodeling
аневризмы. Вот
after a
посмотреть
very
через
simple
2
treatment for
года,
such complex
класс
case.
5.
So this
Очень
remodeling develops in a
устойчивое
longer period of time of
ремоделирование.
MCA
Поэтому
bifurcation. So one
мы
should not be
говорим, что
frustrated with 6
ремоделирование
month follow-up
требует более
results.
длинного периода
So this is
времени, и
this is the first case I
не
show you. Remember,
обязательно
6 months later, the result
строить
was not
свои
great.
выводы
Aneurysm is
на
still filling. The
результатах,
vessel, the
полученных
superior
через
trunk is
6
not done.
месяцев. Вот
It's
здесь
done.
было
The patient
не
was
идеальное
asymptomatic.
состояние
12 months
через
later,
6
at that time, with the
месяцев, а
clopidogrel
через
time, we did
год
not have affiant, and clopidogrel was
прекращено
discontinued. Aneurysm
использование
started to refill back,
клопидогреля,
and this is the 18-month
они
control with the class
и
1
вот
inclusion.
контроль через
So it takes
18
time.
месяцев,
This
класс
is the 10
1А,
years.
а
It
вот
takes
через
time.
10 лет.
So
То
with the
есть это
6 months
длительный
follow-up,
процесс. И при
we should not make
наблюдении
a
через
paper
6
and tell that
месяцев
the aneurysms
не
failed to
стоит
occlude.
сразу публиковать
We have to
результаты и
wait.
говорить, что ничего
Okay?
не
So
удалось.
this is the treatment.
Нужно
And this is the patient I
подождать.
got from
Вот
the
это
G1 again.
осуществление лечения.
3.5
Вот
years later,
пациент,
aneurysm got
посмотрите, через
occluded.
3,5
3.5
года мы
years
видим
later.
окклюзию
So what is the
аневризмы.
problem?
3,5
The patient is
года.
still intact.
Так какая
So
же проблема?
basically,
Пациент
complex
по-прежнему
MCA
интактный.
bifurcation, simplicity, vessel
Поэтому
straightening,
при
geometrical modification.
бифуркации
This is the 6 months. This is the rotational
важно.
of the 6
Вот
months.
посмотри, через 6
Okay, we call
месяцев
it aneurysm remnant.
ротационная
And this is the 4
аневрия, мы
years.
говорим о остаточности аневризмы. Вот
Class
ситуация
5 stable
через
flow
4
remodeling.
года. Класс 5
So technique is
устойчивое
simple.
ремоделирование потока.
Simplicity. There is nothing
Поэтому,
to explain.
итак,
We just oversize the
простота.
pipeline according to the
Здесь мы
proximal vessel
просто
size,
увеличиваем,
because most of all
используем
these aneurysms are convexity, so we give a
пайплайн
time to aneurysm because it's
большого
convexity. We
размера.
increase
Нужно
we decrease the
подождать.
mesh density with
Мы
oversizing a little bit and give the time
видим,
to the
что
integrated vessel. And the concept needs to be set in our
увеличиваем
mind that
размер
simplicity is the
и
most ultimate
ждем, и
sophistication.
понимаем, что в
As
рамках
you
нашей
realize that I'm showing
концепции,
you
как я
very
уже
easier
говорил,
cases to
простота —
handle with other
это
means also.
высшая степень
So these are our
всеобъемлемости,
numbers. Actually,
изощренности.
until
Вот
at the end of
некоторые
2021, we have much more patients
цифры.
now, and
К
it's been
концу
shown already
2021
and
года у
published
нас
that
уже
in
гораздо
many
больше
series that
пациентов
that
было
it can be
охвачено,
done very low with low
опубликованы
mortality,
результаты
obviously
по
because of technique
сериям.
simplicity with the new
И
medications.
здесь
And
мы говорим о
last three
снижении
slides,
смертности.
we have different
На
solutions for a
последних
similar
3
problem, my
слайдах хочу
friends.
показать,
That's
что
the tip.
решения могут
Why
быть
stand a
разные
stiff
для
coiling? We like that.
одинаковых проблем.
That's the tip. If it's ruptured, web device is a great treatment.
Если есть
And
разрыв
flow diverter, the art of
и
simplicity.
вот
And you can wire it for
флоу-дайвертеры
such aneurysm
используются
to
именно с
inferior
целью
trunk and do Y stand,
упрощения
or any
подходов.
similar
И
aneurysm. You can place
можно
the web
использовать
device in a ruptured
расширяющие
aneurysm and
двойные
like this,
стенты,
or
койлинг
you can
с
just place
стент-ассоцированный
extracepular flow
койлинг.
diversion to
Можно
have this
также
remodeling.
использовать модификации
But in the
потока
future, I believe,
внутримышечно
this is a
и
patient,
так
as the
дальше.
last slide,
В
I
будущем,
treated
я
in
полагаю,
2009, and
нас ждут
unfortunately he lost
перспективы. В
his son
2009
after I
году
placed his
я
flow diverter
лечил
across the neck of the
пациента.
aneurysm,
К
and I could not persuade him
сожалению,
to do any follow-up, obviously. And 10
потеряли
years
его
after, I
сына
was
после
able to
похожей
persuade him to have
процедуры,
an MR
и я
angio.
тогда не мог
I believe
убедить
in the
пациента
future,
пойти на
if we have enough evidence,
соответствующее
we're
лечение
just
с
going to place a
ремоделированием потока,
pipeline
но
and
через
forget about
10
the
лет
others.
я убедил его, и это было
So this
достаточно
brings the
успешным.
unbeatable simplicity.
Поэтому я бы
I'd like to
сказал,
invite
что
you, all of you,
ничто
to the
не может
Istanbul,
подорвать
and WNRC
простоту
2021 is
подхода.
going to be in
А
Istanbul,
сейчас хотел бы
and hopefully
пригласить
we
вас
keep
на
discussing these matters all together.
мероприятие в
Thank you very
Стамбуле,
much.
где мы будем более подробно говорить именно о таком подходе.